Let me welcome all of you to the first seminar, CSPS, every other week, Thursday. We organize seminars and we try to share with you our research findings, sometimes the faculty or external faculty. And so today, we have a paper titled Welfare and Fiscal Cost Implications of Extended Pension to Informal Workers in Developing Countries. And this paper was put together by three faculty members. Dr. Opoku, who is the lead writer and the main person who motivated this particular study, and I should say did greater part of it. He was assisted by George Domfe, who is also a faculty member, and Antoine Chibodakon, also a faculty member. And so this afternoon, we have here Dr. Kwadwo, a public sector economist, a very renowned one as for that matter, who is here to tell us about the welfare and fiscal cost implications of extending tax pension to informal workers in this country. We all know because of the informal nature of the Ghanaian economy, a considerable proportion of the elderly do not have pension. In this country, the elderly constitute about 7%. So every 100 people that you meet, 7 of them are elderly. We describe an individual as elderly if the person is 60 years or older. And most of them have to work until the last step to the grave, which is not good enough. And so we have been trying over the years to see if there's a way government can come in to extend pension, scheme to cover every elderly person in this country. And this is part of the process to get to that end. And so without much ado, let me invite Dr. Kwadwo, the lead writer, to take us through what he has put together that George Domfe and Antoine Chibodakon supported. Thank you all for coming. Dr. Kwadwo, the floor is yours.
Thank you very much, Mr. Chairman, and thank you very much all the participants. Thank you for joining us for the first seminar this semester. So as you can see, the topic for this afternoon is welfare and fiscal cost implication of extending pension to informal workers in developing countries. So I work with my co-authors to put out these papers, and as is the first presentation where we have, this is the first place that we are presenting this paper. So any comments is welcome, and we will take it on board and use it to improve our paper. So first, I look at so as a way of the outline, I have the introduction, the model, data estimation and calibration, then policy experiment and conclusion. So this is how I organize the my presentation. And I want to provide the motivation to this paper. So we see, as Dr. George Domfe talked about, for those who are older people in the world, throughout the world, that is those older than 60 years or more. There are about over a third of them, which numbered about 652 million, live in developing regions. That is developing countries, poor countries, underdeveloped countries. So many of the people who are older people, they don't, of course, the Europeans and the Asia people, many of the developed countries, they have them, but we have a lot of them also living in developing countries. In Africa alone, it is expected that by 2020, as it was going to 2050, sorry, it was expected that it will increase by 40%. The number of older people living in Africa is expected to increase to about about 40%, increased by 40%. That tells you that we need to start thinking about older people. If you are going to increase like that, then you have a lot of older people in our population. So we need to think about them, their poverty and everything. And we also know that, yes, if you are living in your family, your house, and there are people who are growing older, the population aging, we all want it. So it reflects positive milestone in development of societies. So once in every economy, we see that people are living old, they are living longer. It means that we are providing good health care. We are also probably are providing good nutrition to them so they can live longer than they used to be. Because, for example, in Ghana now, in 1990, an average person was expected to live to age 47. Now, you are expected in Ghana here, you are expected to live around 65. So it has increased average lifespan. Even for those that have getting to age 60, that is conditional life expectancy has increased a lot. So we need to start thinking about them. So once people are growing older like that, then it also comes with problems. And these include they are growing old, they are weak, and therefore their productivity will also reduce. That will come with low incomes. They may not be able to participate well in the labor market. And for the economy, it also affects the social security system, how the social security is organized. We need to start thinking about them in terms of insurance for them to have access to healthcare, and also something that they should, something that their income that they could use to eat. So all these things come with when you are having a lot of people living who are older, who are old and they are living. In many low-income countries, aside when we are seeing the trend that a lot of older people are living longer, we are also saying that in lower middle income countries, which have a lot of large informal employees. Because of the large informal employees, we see that less than 20% of workers, only less than 20% of workers are covered by social security or pension schemes. That is few of the people currently working. So if you look at currently in Ghana, you look at our data, we see that many people will retire, they will get to age 60 without any pension. And in the data, we see that in many countries as well, less than 20% of working population will have access to social security or pension. And that means that there is high prevalence of poverty among older people. And so people who are already old, we see it. And people who are going to grow old, we see that their poverty level will increase. So a key survival strategy that many older people use is what in the literature we call it ceaseless toil, ceaseless toil. So they continue to work until they die, until few years that they die. So they are old, with all the frailty, they continue to work in order to eat. If they don't work, it means that there's nothing for them to eat. So we see this as a survival strategy that older people usually use. So we want to make a case for pension expansion to informal sector. Looking at the prevalence of poverty among older people, it means that if we have pension for them, then it may help poverty reduction. Now, how to do it? The recommended approach is what we call a non-contributory universal minimum or basic pension financed by general taxes. So in Ghana, we tried to reform our pension system and we couldn't reform it well. We'll still say that for you to get access to the basic one, you need to contribute. And you can only mandate people who are working in the formal sector. Those people who are trading in the market, you cannot mandate them. You cannot force them to contribute. And they will grow old and become poor. You don't want your people also to be poor. So the World Bank has recommended that this one, it should be financed by general taxes, maybe resource tax or consumption tax, something that everybody can contribute, not only those people like the former pension system that we have. So you can have second tier and third tier that deal with the former workers or former employees. But for the basic one, allow everybody so that everybody, once the person is old, he can have access to a pension. You want to prevent poverty. So somebody, a given level, at least, not much, but something that for the month or for the week, people can depend on. But many developing countries have not been able to do that because of the potential fiscal cost. You always hear about a fiscal deficit, borrowing, debt, and so forth. We are not able to tax people. So they are afraid to introduce a tax like this because it will impose a cost on us. And of course, we also have other important like education and social service like education, infrastructure. All those things are competing with doing a pension for older people. So in Africa, only 7 countries are implementing non-contributory universal non-mean tested pension schemes. So we know World Bank has recommended it, but we are not able to implement it in Sub-Saharan Africa. So 3 key questions that this paper tried to answer. First, if you introduce the pension scheme, what is the welfare impact of it? Then second, if we intend to introduce it, what is the appropriate amount of pension or transfer if such policy is introduced? And third is what will be the fiscal implications of implementing such a pension scheme? So these are 3 questions that our study tries to answer. So what we do, we want to give a preview. What we do in this study is that we develop a structural life cycle model with quantitative analysis. So life cycle is said that we introduce human beings into an economy who some will work in the formal sector, some will do other things, and they will grow old. And when they grow old, some may be sick and become disabled, they can't work. Some will continue to grow old with frailties. Their income level will be low, as we have just said about how old people find out. So all these things will be contained in the structural life cycle model. And we are going to use this life cycle model as a benchmark of economy as exists now in Ghana, where formal workers enjoy pension, but informal workers do not have pension. Then we do an experiment that if we introduce pension, what will happen? And that pension, we are going to say that it is financed by, you can't, if like we introduce free SHS, somebody has to pay. So we are saying that if you introduce pension, it is going to be financed by consumption tax. And you do this because if you introduce income tax in the developing countries, many people are not working in the formal sector. So government can really not tax them. But for the consumption tax, once if it's on sugar, everybody will pay it. So everybody will be affected. So we will finance the pension scheme with a consumption tax. Then we determine the optimal pension amount. Then we look at the distributional effect of the pension policy. As we say, some will be paying tax and some will be enjoying the pension. So we look at how it will affect them in terms of welfare, each sector of the population, how they will be affected. So this is what we are going to do. This is what we do in this paper. Then, so this model is developed for developing countries that has this character. Large informal sector do not have pension for the informal sector. We develop it for them. Then we try to use data from Ghana. And why do we choose Ghana? It's not because we come from Ghana, but we talk about large informal sector, and over 86% of workers in Ghana are in the informal sector. Also, there are ongoing discussions in Ghana about improving pension coverage so that we can guarantee income security for older people. So you can see this in the Ghana Aging Policy 2011. And recently we have seen that there is a policy manifesto, specifically MPP, have introduced, have said in their manifesto that they intend to extend the coverage of social assistance, apart from LEAP. So they mention of LEAP, apart from LEAP, they intend to extend it to cover all uncovered older people in Ghana. And this is kind of a pension scheme, social assistant, age-specific, old age-specific social assistant. That means they are thinking about older people. So we see this as like people have started thinking about pension in Ghana. So in this case, we need to help in terms of the discussion and the debate about pension scheme in Ghana. So we review some literature on this, so few literature on it. There are some social partial equilibrium models where they consider people with pension, how it affects their labor market outcomes and other things. So there are few studies that have dealt with it. These are the literature on it. And there are others also in general equilibrium analysis in developing countries, which have also worked on it. Juan and Trang 2012 used data from Brazil to do it. But of course, for Brazil, though they have the informal sector, but informal sector is not so large, it's about 40% of their workforce. So it's unlike what we experience in large, in developing countries like Ghana. So what we do is that we contribute to this literature in a setting with very large informal workers. And none of these studies try to estimate the optimal pension transfer. And this study tries to do that. So I will try to explain the model that we are going to use. So we ex ante, that is before people come into the economy, we have individuals with different education levels. So once they are born into the economy, so we are going to assume that people come into the economy after they graduate from university, age 25. So they are introduced into the economy at age 25. So we have people with no education, people with JHS education, people with high school education, and people with tertiary education. So there are four groups of individuals differentiated by their level of education. And this will determine their income level. Then we also have people differentiated by the employment sector, in that people work in the formal sector and others work in the informal sector. And we do this in a life cycle model from age, once you are introduced in the economy, that is age 1, J is equals to 1, 2, your last age that you spend. So we assume that you start life and you die definitely by age 90, but everybody will die by age 90. But from age 60, people will continue, people die by survival. People will survive and others will die. So there are survival probability that we know. Then for those in the formal sector, there's a mandatory retirement age, which is age 60, which in our model is given by J and subscript I. So this is how, in terms of the life cycle pattern we have in our model. And there are formal workers who receive pension, as I've said. There are informal sectors who do not receive pension. But in Ghana, for example, the old and disabled informal workers receive LEAP. So we provide an avenue for them who cannot work at all. They are old and they cannot work. So as we say, scissors toil, they have to continue to work until they die. So many of them do, but people who are disabled cannot work. And so in the economy, it's like the LEAP provided for them. Of course, we know that in the family setting, it could be that a father and a child will always transfer money to them. So all these things are being provided by LEAP. We, in this model, LEAP provide all those monies that people who cannot work get through LEAP. So this is our utility function, which shows what you derive from consumption. So C is consumption. I was saying that anything that you consume, you get some satisfaction, which is given by use. So any consumption, food that you eat, anything that you buy food with it, anything that you buy, you buy with income, you get some level of satisfaction from it. So C give you a level of satisfaction given by you. Then we say agents choose consumption to maximize expected lifetime utility. So living from age 1 to your last age that you die, you always choose your consumption so that you maximize your level of utility. And that's which the equation 2 provide. So, but individuals face problems. You don't have unlimited resources. So your value function at any point is given by equation 3, which is the utility function that you get from consumption. Then beta is your discount factor. That is, consumption today is higher than consumption tomorrow because it's in future. You usually prefer things that is happening now. So that's what I will explain it. And 5J is the survival probability. To live next period, there's probability that you will die. So to live and get it depend on the survival probability, and you'll get your value for the next period from it. But you decide on how much you consume, that is, you maximize with how much you consume and how much you save. So we see that all these decisions that an individual like us will do depends on your budget constraint, which is your consumption, and you face a consumption tax of tau C, like this one. And when you choose your consumption, you also make decision on how much to save that you take to the next period. Then Y is your total income. And when you save your money in the bank or wherever you buy treasury bill or whatever it is, that you have it, it will also give you an interest. So 1 plus R is the gross interest that you get from savings. And with your income, you can decide on how much you save for the next period and how much you consume. So the informal sector does not, we don't tax people on their income in the informal sector, but for formal sector people, they are taxed. So that is the younger people, those who are living before retirement. Before retirement, these are decisions that young agents problem that they solve. Then once you become old, this is the problem that you solve. You are facing a health or disability shock, which is given by age. You don't know that you can work tomorrow, because it's only when you work tomorrow, that's next period, that's where you can get income. But you face a shock, and this is given by the probability, PH, that you live to the next period once you become old. And this is also the budget constraint and the income. So for the older people, you can work and you get income when you are not sick, given by age. But when those who are sick or disabled, 1 minus age, they will get leap. So those who qualify, who are disabled, they qualify to get the leap amount. And this is for the PEN-FE, is for the pension for the formal sector workers. And in our experiment, we introduced non-contributory and pension system for informal workers. So this, in the normal economy, as we see it, it is not there. But once we introduce it in the economy as policy experiment, we will see this one for the informal workers. So this will be, government will ensure that the leap amount and the pension contribution its budget balance or balance with regards to all the tax revenues that it collects. So this is how its budget balance. You are assuming that government does not borrow. It's going to raise tax revenues to finance the leap and the pension that will be introduced. So in our benchmark economy where there is no pension, it means that government will only introduce tax or collect tax revenue that is appropriate to finance only the leap amount. So basically, data that we use is from mainly from Ghana Statistical Service, GLSS round 7, actually round 7, that is 2016-2017 amount. And we have parameters that identify externally, that is those that we get from GLSS, and those that will be, we will get it from the model. In that case, we try to minimize the distance between the model and the target data. So for example, we try to ensure that the model poverty is equivalent to the poverty in Ghana now. So older people in poverty is about 24%. So we ensure that in the model, poverty level among older people also about 24%. That is what we mean when we identify it in the model. So some of the parameters that were identified externally were the education status. We see that in Ghana, about 13.7% are in the formal sector currently, and the rest, 86.3%, work in informal sector. Then along education levels, we have 45% of current workers who have no education, 31.6% with basic education, and those with high school education is 10.8%, and 12.4% has tertiary education. And along formal and informal workers, they are also here. So we look at wage profile. So we want to see from age 25 to retirement for formal sector workers and until age 90, how the wage profiles, we see how the wage profile behaves. So we see that for the informal workers, by age 40, they peak because it is more of what they call it brain and brow and brain. If you use your energy too much, we say it is brow. So you use your strength. And those with the brain, in the informal sector, you can see that it's possible that the strength is more needed. So by age 50, age 40 to 45, they reach their peak and their income levels start falling. And we see for the formal sectors, before they retire age 90, so their income level continue to rise until age 60 when they retire. And this look like the normal data as people are getting longer in their companies. They are spending long time in their companies. They receive a lot of wage increment, and it comes with experience. Then we see this, what we say disability shock or head shock. This is given by age. We see that it increases as people grow old. The probability that they will get sickness, that they will not be able to work, either because of old age, they will not be able to work, or the disability shock, they will not be able to work. It increases with age. So this is what we do when we compare the values that we use for our estimation. So those one that we estimate is risk aversion parameter, as we see in consumption, and the beta annual discount factor, which is 0.97 that we see. So these were estimated, and to make sure that the poverty level in the data, GLSS, correspond with the poverty level in our model before we do the experiment. So once we're able to get the target right, we start with our experiment. So this is the results and the policy experiment and the results. So once we introduce non-contributory, non-mean tested pension, we see that without pension, we only need a tax about 0.5% on consumption tax, what we can call a VAT, in order to finance LEAP. But once we introduce social pension, the tax rate depends on how much we give to people. So this is annual. Annually, if you are giving us a 2017, if we are to giving 360,000 per annum to older people, those who are older than 60, and they are not earning any pension, they are not receiving any pension, you need a tax rate increase of about 1.7%. If you are to give 1,800 per annum to them, you need a tax rate of about 6.4% increase in consumption tax in order to finance it. So you see that tax rate increases with how much you give to pensioners or older people. Now we want to look at the welfare implications, how we estimate welfare. So I will not, because of time, I will not do it. So we estimate, we see whether the policy will improve in general social welfare or not, using what we call consumption equivalent variation. Consumption equivalent variation. And we have a formula that derives it. And this is what we get, the value function with reform after we introduce pension, divided by value function with the benchmark economy. And with this function, we estimate whether it will improve or it will not improve, welfare will improve or not improve. So a positive CEV suggests that the reform increased welfare in comparison with the benchmark economy. So if you get a positive, it means that people living in an economy with a pension is better than people living in an economy without a pension system. That is what it suggests when it's positive. If it's negative, it means that the policy is not good, because when you introduce the policy, it reduces on average social welfare of the people living in the economy. So we see welfare is going to be affected because there's redistribution from formal workers to informal workers and from the young to the old. All people will be paying the tax, but formal workers will not be receiving the new pension, but the older people will receive the pension. So it's kind of redistribution. Younger people will be paying tax. When they consume, they will be paid the tax, but they will not receive pension. So it's kind of a redistribution in that manner. This will be intergenerational redistribution, and from formal workers to informal workers will be like intra-generational redistribution. So we see all consumers pay higher consumption tax, which is negative welfare effect. So tax is not good. It reduces your consumption. So it is not good. But older informal workers benefit from the pension scheme. So the overall welfare implication is uncertain. So we need to analyze it quantitatively before we know that the policy is good or not. So once we do that, we can determine our, so we have the CEV, compute the percentage change in consumption equivalent variation. We have it, and we determine the optimal pension. So we see that once you continue to give pension to people, the welfare start improving. Sorry. Okay. Yes. Okay. So once you start giving pension to people, the older people, we see that the social welfare improves. But it gets to a stage, if you continue to increase the pension amount, it will get to a stage, then it will start falling because you need to tax people, and people will be feeling the negative effect of tax. So then you have to determine the optimal amount. So the optimal amount is around 600 Ghana cedis in 2017 prices, 600 cedis in 2017 prices. As if you were to introduce this tax in 2017, they will need about, that means about 50 cedis per month. That is 50 times 12 will give you about 600 cedis at that time. So the 600 at that time will be the optimal social pension. Now with this 600 cedis as the optimal social pension, we want to see the implication on each categories of individual that you find in the economy. Those with no education, basic, secondary, tertiary, informal workers, and others. So we see that people with no education, they benefit. People with basic education, as I said, when it is positive, then it tells you that they benefit from it. So we see all of them benefit. The informal workers benefit. Their social welfare will improve by 9.8%. But if you look at informal workers, you see that their welfare is reduced by, formal workers, their welfare is reduced by 1.7%. So they suffer from the policy. And we see this, another study have been done on free SHS, and we see a similar results. So we see the rich people, and they don't benefit from the policy. Their welfare actually reduced because the policy needs to be financed by a tax. And because they know that they can send their children to school, probably in a private secondary school, and they will be taxed and they will not benefit from it. So they use similar model, and they were able to see that a tax like this will improve people, the poor people welfare will increase. Those with no education, their welfare will increase, but the rich and the educated people, their welfare will be reduced. And so for that study, they came to Ghana and they conducted a survey. And the survey actually shown that actually the rich and the highly educated people, they do not support free SHS. So in a policy like this, you see that because the rich, they will not, and the formal workers, who are usually the rich people, they will not, because social welfare reduced, they are not likely to support a policy like this. So a policymaker needs to do things to convince these people in order to introduce a policy like this, because they are the losers. They are gainers of the policy. But as you know, every policy has will benefit some people and others will lose. So the rich in the society are likely to lose from this policy. So they may be against a policy like this. But overall, in terms of overall, social average improved by 8.2% if we introduce this policy. Now, one part of our question was to determine the amount or the fiscal implications. So we look at today, when the amount was 600 cedis. If you consider inflation and we consider the population, the number of eligible older population, old people population, we can estimate the fiscal cost of the policy. And if you look at 2021 population census, for those who are older than age 60, we have about 1.7 million people. For those older than age 65, we have about 1.2 million people. And if you consider those older than age 70, we have about 700 or 800, let's say approximately 800 million people. So even if the policy said that it is costly for using only age 60, you can introduce it and give it to those who are older than age 70, so that we do the cost. And so once we do this, we estimate the cost of pension in Ghana cedis. And if we were to give it to anybody who is all informal workers older than age 60, it will be about 3.6 billion cedis, Ghana cedis. If we are to give it to all older people older than age 65, but without any pension, amount that government will have to spend will be about 2.4 billion cedis. And for only those older than age 70, that will be equivalent to 1.6 billion Ghana cedis. And in terms of GDP, very small, 0.35% of GDP, 0.23% of GDP, and 0.16% of GDP. And in terms of domestic revenue, that is taxes that we collect, this will be just about 2.1% for those, if you have to give it to everybody older than age 60. And if we concentrate only on those who are older than age 70, that will be about 0.92% of domestic revenue. So we provide our concluding remarks, but because of time, we summarize it. Because of time, I will stop here to ask for questions and comments. So Chairman, thank you very much for being here.
Yeah, thank you very much, Dr. Opoku. That is very insightful. So if government decides to roll out this policy, the Ghana government is going to spend about 3.6 billion on those who are 60 years and above. We have to cover those 60 years and above. 2.3 billion for those 65 years and above, and 70 those above 70, 1.5. If we look at the system, that is almost the same amount currently Ghana government is spending on free SHS. And we all know, as you rightly put it, free SHS, some people don't support it, especially those who have so much and they don't care so much about what the government is doing because their children even don't attend public schools. We have some Ghanaians, their children don't even attend schools in Ghana. Right after JSS, they are sending their children abroad, and so they care less about what is happening. But I like this Akan proverb that goes that I am because we are. So it's not so much about how you, but it's about the society. And so I think that it's a good policy. People are dying. If you go to the villages to see how the elderly over 60 years, over 70 years, and they have to go to farm so they are able to put food on their table. You know, this has happened because the extended family system that used to take care of the elderly is declining. You know, on a very fast note, it's not working anymore at the village. And so because of modernization and migration, all the people have traveled, the children, the grandchildren, they are in Accra chasing and other cities, chasing, jobs that are not existing. And so they hardly would get enough to meet their needs, yet alone to think of sending anything back home. And so the old ladies and the old men we've left home are struggling to maintain livelihood. And this is the situation we find ourselves. And so I don't think it is bad if government should do something like this. And so I congratulate Dr. Kwadwo for leading us to put this piece together. But it is important that we open the floor for you to make your comments. So this is what we have. This is what we have presented. We want you to tell us what, in your view, can help us make this work look better. Is there anything we have to add or take away? Or is there anything that he said that you didn't get it well and you want further clarification? So on this note, let me open the floor and welcome questions, comments, and suggestions. So we have Dr. Appiah Johnson. So let's begin with Dr. Appiah. Doug.
Okay, so I have just two quick questions. On the last table, I'm seeing the benefits. Are you considering giving the benefit to only the informal or all people below, let's say, 60? Is it talking about the formal and informal, or only the informal? You have to make it specific. So that's one question. Then also, in some of your tables, I saw you giving figures from GLSS 6 and GLSS 7. I was getting confused. Which you have to specify which data set you were using. Thank you.
Okay, so yeah, Doug, you come. Let's take a few questions and then you come to respond all of them. Pearl.
Yes, Doc, thank you very much. And thank you, Dr. Kwadwo, for the presentation. A quick question on scope. In the literature review to support this study, did you find anything about the implications of provision of these welfare benefits to the older population? Currently, we know that even the pension received by formal sector workers is hardly adequate to take them through the month. And for a lot of the people in the informal sector who are currently not on welfare, they are probably depending on family members to provide for food and medication, etc. Could there be a negative impact of implementing an intervention like this, where if you know that, okay, my uncle who was in the informal sector is now receiving something, so even though what he may be receiving is not enough, I'm not really obliged, or I don't have any obligation to send him anything because he's receiving something. Just in terms of scope, did you look at that aspect as a potential implication of the provision of the welfare benefits to the informal sector? Thank you, and over.
Thank you very much for that very long questions. Yeah, I don't see any other hands, so Dr. Kwadwo, you may come in and respond.
Okay, thank you, Doc. So, for that table, we are those who are. It's only for those who are currently not receiving pension. So those who will be found themselves in the informal sector and therefore they will not have pension. So their population is what I provided. Then it's GLSS 7. GLSS 7 is what I use. That is 2016, 2017, but I think I'm in writing it. I use the GLSS 6. I wrote GLSS 6, but it's GLSS 7, 2016, 2017. Thank you very much for the question. Yes, in the literature, we see it. So there's a term for it where once it reduces intra-family transfer. So we see that once government introduced this kind of, I think Vietnam, there was a study like that I think Joanne and something that I cited, that was able to see that once government start giving pension to older people, the family members reduce the amount that they transfer to them. So there's that kind of real allocation over there in it. So that is also there. But of course, in general, we are looking at some are getting it. About, as George was saying, if you really look at you go to the villages and look, even in the urban cities, you see there are people that they don't get anything to support. Recently I was in a meeting where I think Profaka was doing a project and people had to, on older people. So they had to interview them. So as part of the interview, when they respond to the questionnaire, they gave them 50 cedis for each of this year. They gave them 50 cedis for making themselves available to respond to the question. And he said that after they finished, after 1 month, he received a lot of calls. They are asking him if there is any other project like this so that they will come, so that they will get 50. Because, in fact, many of them use it to buy medicine, just 50 cedis. So you can see that there are many people that are currently suffering. So, for example, the 600 that are provided us at 2016, if you consider the inflation and everything, today, every year, it means that we should give people about 22,000 Ghana cedis every year. That means every month, if you divide 20, that would be about 1,700 or something given to every older person for the period. So it has, the literature shows that it may have those kind of negative effect in terms of private transfer. Thank you very much.
Okay, so I see a few hands. Let's take a couple of the questions. Douglas Cotti. Douglas. Sorry about your title, so yeah, forgive me if.
Yes, Doc, thank you. I think the research is very insightful and very progressive. So we want to thank you for giving us the opportunity to get this work out. My question has to do basically with the urban and rural dichotomy in terms of pension and the cost of actually living. I think that a study like this, I don't have all the details, so it'll be interesting to know how people in the urban areas will feel and whether the 600, the recommendation will be enough for people in urban areas compared to, say, the rural areas. And then the second thing I would also want to ask is that the price was based on the 2017 price. I don't know how you put it, but I remember hearing that. So my question is that now we are 2017, inflation was 12.37. 2024, we have inflation around 22%. We didn't see the recommendation, so we can't tell what it is. But I'm very sure when you do and you adjust for inflation, we'll be able to tell what would happen and how it will affect us GDP-wise. Thank you.
Okay. Yeah, thank you very much. Yeah, so he talked about 2017 crisis, and in his response to the last question, he tried to quote the current prices. You know, I mean, he was just trying to estimate, give rough estimate for current prices. But I will leave him to answer that. But before then, Mr. Broby. Also, I saw the hands up. Do you still want to ask your question, Brobe? Hello, Brobe.
Hello, Doc.
Yeah, Francis.
Hello, Doc.
Do you still want to ask your question?
Hello, Doc. Good afternoon.
Yeah, good afternoon.
Yeah, this is a very nice presentation, and I think this is my first time of what do you call it, joining the team on this particular project. Now, what I just want to know is about the utility model. Maybe I didn't get it well. So the utility model together with the constraining model. So when it comes to the utility model, which who is getting that particular satisfaction, and the constraining model, who is actually being constrained in this sense? Is it the person paying the tax, or that's what I just wanted to know?
Okay, Francis, thanks very much for that question. Can we have more? This is the last round of questions. We have 5 minutes to go, so I wish we can take the last rounds of. Okay. I think we don't have any more. So, Dr. Opoku, do us a favor to respond to the last set of questions.
Thank you very much. So Douglas, yes, in the data, there's I've looked at it before, but of course there's rural and urban rural dichotomy in terms of population of elderly people. We know that the poverty is very high in the rural areas for older people. And so that one is there, but we did not introduce it into the model. It's also another heterogeneity that we can introduce in the model. But if you introduce a pension like that, we thought about it, but we think that if you say rural, since it is not something that is fixed, people can always change their location. So if you are giving the pension to only older people, everybody has a village. So at the time you are doing the counting, everybody can go to the village and collect it. So we are thinking that it may not be, but other fixed or permanent things that we can use to distinguish people, we can use it. Because, for example, if you take Ghana card, we have information about people educational level. So we can determine, and people who have never worked in the formal sector and therefore they don't have any pension, they can easily be identified. Then, as George said, we use by 2016, 2017, that's a GLSS. So the consumption data, everything was taken, the wages and everything was out of 2017. So once we finished, we wanted to see currently what will happen. So we've taken inflation since 2017 up to now, 2024, and we use this to inflate every year what happens. And we are saying that the 600 cedis as of 2016, 2017, it is equivalent to 2,000 Ghana cedis as of now. So it means that if we are to implement this policy now, we should be giving them about every year about 2,000. And I said that if you divide 2,000 by 12, you will get about 1,700 per month for our older people. Yes, 2,000.
2,000 by 12.
12 months, just 12 months, because it's a year. So,
so the whole year is 2,000.
It's 2,000.
And a month, so it will be about 170
Ghana cedis.
Yeah, 170 Ghana cedis. Right. Good. Okay.
So I think there's one question. So so there was a question on the utility model or the so we assume what do we get satisfaction from? And we are saying that you work, you consume because you get satisfaction from consumption. So anything that you consume is embedded in the consumption. So the food that you eat, a typical consumption is food that you eat. If you watch movies, they are all part of consumption. That will increase. You watch the movies because it increases your satisfaction level. So all of them. But you decide at any period, you decide how much to consume. See, once you decide how much to consume, you are also deciding on how much you are saving for the next period. So this year, you are deciding on how much you are going to consume, given your total assets, which is given by this, and your income that you earn. Then you save some for the next period, next year. And so this is a budget constraint given for the same individual when you are taking decisions. It's not like you have unlimited resources that you can consume anything, but your consumption is limited by how much resources that you have. So it's the same individual that is taking. So if you take a typical person working in the formal sector with tertiary education, he will take, knowing his income, knowing his assets, he will make a decision about how much he consumes, and how much he saves. I hope it's clear. Thank you very much.
Okay, so we have just 1 minute away, and let me use this opportunity to thank all of you for coming, and again say that 2 weeks time we're going to have another seminar. And so before then, the seminar coordinator would reach out to you, and we are inviting all of you to come again for us to think together to develop very good policies for this dear country of ours. On that note, let me say very goodbye to all of you. Bye-bye.